So this is the first cervical vertebra, and the name of the first cervical vertebra is atlas. Today we'll be talking about the anatomy of the atlas bone, inshallah. So let's start. So why it is called atlas? Because it supports the globe of the head, and it is basically a atypical vertebra. So atypical vertebrae are the first, second, and the seventh cervical vertebra. And the name of the first cervical vertebra is atlas, and the second cervical vertebra is axis. So let's talk about the presenting parts. There is short anterior arch and a long posterior arch and two lateral masses, and the superior articular facet, which is kidney shaped, and the inferior articular facet, which is more or less circular. And we can see the foramina transverse area, the transverse process, and there is no centrum or body, and there is no spine. So the centrum or body is fused with the axis vertebra to form the odontoid process of dens. So we can see the odontoid process of dens. So basically, the odontoid process of dens of axis, it represents the body or centrum of the atlas vertebra. And as there is no spine, so the spine is represented by the posterior tubercle. And the anterior surface of the anterior arch, it bears anterior tubercle, and the posterior surface, there is a median facet for articulation with the odontoid process of dens of axis vertebra. And behind the lateral masses, there is groove on the posterior arch, which is related with the third part of the vertebral artery and the first cervical nerve. So now let's talk about the articulations. So it forms the cranial vertical joints. So the superior articular facet of the lateral mass of the atlas, it articulates with the occipital condyle. These are the occipital condyles. So it articulates with the occipital condyle like this, and it forms the atlanto-occipital joint, which is basically a type of synovial joint. And the movements are flexion, extension, and lateral flexion. So the muscles involving the movements of the flexion is sternocleidomastoid muscle, and the extension is trapezius muscle, and lateral flexion both sternocleidomastoid and also the trapezius muscle. And the median facet of anterior arch of atlas, it articulates with the odontoid process of dens of axis vertebra like this, and forms the median atlantoaxial joint, which is pivot type of synovial joint, and the movement is rotation because the dens acts as a pivot around which the atlas rotates. So the muscles involving the median atlantoaxial joints are the splenius capitis of one side and the sternocleidomastoid of the opposite side. And the inferior articular facet of the lateral mass of the atlas, it articulates with the superior articular facet of the axis vertebra, and it forms the lateral atlantoaxial joint. And we can see the sliding and gliding movement here because it is a plane type of synovial joint. Now let's talk about the anatomical points. So this is the atlas vertebra. Kidney-shaped superior articular facet is directed upwards. The posterior arch is longer than the anterior arch, and the posterior aspect of the anterior arch is marked by the facet for the odontoid process of dens. So this was all about the atlas vertebra. Thank you.